Progress.
Hey there, Mike Hodges, Benefit Partners Direct. Thanks for joining us today. And we're going to talk about how you can protect yourself against unexpected, potentially catastrophic healthcare expenses. Unexpected, potentially catastrophic healthcare expenses. Our healthcare system has changed. It's very different than the one most of us grew up with, both in terms of receiving healthcare and the health insurance that pays for it. There's a lot of reasons for that, and I cover that in some of my content on my social media. If you'd like to learn more about that, check us out at Benefit Partners Direct, and you can learn more about this. But for today, I want to focus in on a very specific problem that some of you may be at risk for and not even realize it, and that is your portion of healthcare expenses, even though you're paying for it with insurance, may come back to you and maybe much, much higher than what you originally thought it might be. I want to dive right in, and I'm going to share my screen, and we're going to start talking about different aspects of the healthcare system, different types of providers that you can see where this might be a problem for you. We're going to start off with doctor's offices. So many of you, for many years, when you went to the doctor's office, you had a copay or a flat dollar amount. It might cost you $20 when you go to see the doctor, or it might cost you $50 if they're a specialist as opposed to a primary care physician. And that's, usually a pretty good deal. Most people didn't think too much about it beyond that. They just handed them that kind of magic health insurance card and it all got taken care of. Now, of course, you know that it doesn't cost $20 to go to the doctor. It costs a lot more than that. But the insurance company takes care of that behind the scenes. They go and negotiate with doctors, hospitals, everybody else, and they don't pay retail, of course. Insurance companies pay wholesale prices. So they would negotiate a discount on behalf of their people, and you wouldn't see the balance. You would have to just pay the $20, and they would pay the balance on the back end, and you wouldn't get a bill, and everything would be fine. That started to change a few years ago when insurance companies started making doctor's visits subject to the deductible. And for those of you that don't know, a deductible is a flat amount that you have to pay before the insurance company kicks in. And so, excuse me, a lot of these policies that you have nowadays, you might have a $3,000 deductible or a $5,000 deductible, and you're going to have to pay that much money before the insurance company kicks in. If you find yourself in that situation, what I'd like you to start doing when you go to the doctor's office, always ask for the cash price. Always ask for the cash price. What has happened is a lot of providers, they're giving discounts to not just one, but two, three, four, five insurance companies, plus the various government programs that they contract with, Medicare, Medicaid, TRICARE. They have different fee schedules that they're trying to keep track of. And because they know they're going to have to give a discount off of their retail price, because they know that they'll oftentimes have to jump through a bunch of hoops and fill out a bunch of paperwork in order to get paid, they keep raising their retail price. They keep raising the prices that they charge and submit to the insurance company, knowing that they're going to take a haircut and be forced to give a discount. On the other hand, if you walk in and just say, hey, forget the insurance, what's the cash price? If I put this on my credit card, I'll just give you cash here today. What would it be? You might be surprised. If it costs you, say, for example, $150 to go to the doctor, and you file it through your insurance, they might give you, say, a $40 discount, and you would wind up being responsible for $110. On the other hand, if you put that on your credit card and you just give them the money right then, they don't have to jump through any hoops. They don't have to fill out any paperwork. They can get cash money right there. They might charge you $90. And it could give you a discount off the 110. It's worth asking for. Now, the one caveat I'll say is that a primary care doctor, it's probably not going to be that big of a discount. A specialist physician, it might be a bigger discount. It doesn't hurt to ask for the cash price. Along with that, I'd like to emphasize to you, make sure that your healthcare decisions are not going to be made on whether or not your insurance covers it. Make sure that they understand when you go in there, I'm willing to pay for my healthcare decisions. If you think that something should be covered, if you think I should have a test, if you think I should have blood work, I want you to tell me based on your medical opinion, not based on whether or not you think my insurance will cover it or whether or not you have to get approval for it. I want to know what's best for my health. We'll figure the paying part out later. Because again, what you're going to find is our healthcare system has been broken, and that healthcare and health insurance have gotten kind of tangled up together. And a lot of times, insurance companies are increasingly having far too much emphasis when it comes to your clinical healthcare decision making. You want to make sure your doctor's office knows, listen, I'm here for the clinical care. We'll figure out the financing later. Tell me what needs to be done, and then ask for the cash price, and then make your decision. May or may not give you a break on that. If they start referring you out to other people, I mentioned specialist physicians can be higher. Another ways is when that you can get really burned badly will be with lab work and blood work. And it's absolutely critical if your doctor tells you we're going to get an X-ray, we're going to get an MRI, we're going to need some blood work. Shop, 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 and ask for cash prices. I'm going to show you a few examples here of some of the differences. I'm going to let you know, as you see there on the screen, there's a company called greenimaging.net. Greenimaging.net. If you need diagnostic testing, X-rays, MRIs, CAT scans, I highly encourage you to go to that website and let them do. They've done some of the shopping for you. They have negotiated deals with different companies in your area. You're liable to get a much better price, and particularly ask for the cash price when you go there. I want to show you some of the differences, why this is important, because again, this is going to get paid in all likelihood towards your deductible. If you have a $5,000 deductible, you're going to have to pay for the first $5,000 worth of care. Take a look at this. These are some bills that I found online in a survey for an MRI, lower limb extremities. You can see there, it's in the Hershey, Pennsylvania area. One provider charged estimated out of pocket $3,468. The other one, $392. Obviously, which would you rather have applied to your deductible? Which would you rather pay? Another example I can tell you, just in my hometown, when my wife went to get her mammogram, she called up one place, and a mammogram that was being read by a board certified radiologist, one place charged $697. And right down the road from where we live, there was another place that would give her the same mammogram read by a board certified radiologist. The cost was $97 or $99. So it's literally $600 difference. You're paying for this, folks. And if you just blindly hand your insurance card to people, you're giving up control of your leverage with regard to where you're getting it. You wouldn't do that if you were buying a car. You wouldn't do that if you were buying a flat screen TV. You should shop for healthcare the same way that you should shop for everything else. And again, ask the cash price. Don't think necessarily that because you run it through your insurance, you're going to get a better deal, because a lot of times you won't. Hospitals are huge. Few tips on saving from hospital bills. Only use the ER as an absolute last resort. You want to use an urgent care center if your doctor has a benefit for you. If they see people for semi-urgent care, do that. There are some good facilities in many towns. I know CVS and Walgreens sometimes have a walk-in clinic. You don't want to go to the ER unless you really need it. Obviously, if you're having a heart attack or if you're bleeding badly, if you medically need the emergency room, go there. But if you have an urgent care rather than an emergency care situation, use an alternative provider whenever possible. Use an alternative provider whenever possible. Again, I'm not giving you medical advice or legal advice. If you're having an emergency, go to the ER. But if it's not a true medical emergency, use alternative providers. And if you do have to go to the ER, tell them that you're a cash customer. Just tell them, look, I'm going to pay for this out of pocket. What happens a lot of times is that they will treat you in the ER and then they will send you home. If you get admitted into the hospital, then it's probably okay to use your health insurance. And when I say admitted into the hospital, that's when they give you a hospital bed and they check you in, or if they roll you straight back into surgery or straight back into the intensive care unit. That means you're pretty sick. That means you're pretty bad. And a lot of those insurance company discounts that you get are going to kick in, and it'll be beneficial to you to use them. So if you get admitted as an inpatient, or if you know that you're going to be staying there for a while, go ahead and give them your insurance card. But a lot of times, if you're maybe you got some minor stitches or you've got some bleeding and you need it to be taken care of, or you're not quite sure what's wrong with you. There's a good chance where they may just look you over, make sure that you're fine, you're breathing, your heart's normal, you don't appear to have any head injuries. They might just send you home and say, follow up with your primary care doctor. There is a huge, huge, huge markup for those services. You want to make sure that you're a cash customer. In some markets, the discount for paying cash can be up to 90%. Can be up to 90%. Also, when it comes to receiving any care of any kind of elective surgery, in particular, I want to show you this. This is called the battlefield consent form. If you have to go in, say, for a knee replacement surgery or any kind of big elective surgery, they start handing forms to you. They say, sign here, sign here, sign here. And you may feel like you don't have any kind of leverage. Well, I need this health care. This was developed by an attorney and developed by an organization called Never, that has a book, Never Pay the First Bill. Never Pay the First Bill. And this is their version of the battlefield consent. I consent and acknowledge responsibility of payment, inclusive of any applicable insurance payments for appropriate treatment with reasonable charges up to 2 times the Medicare rate. Now, the reason that you want to put this in is that we've all heard the horror stories, and I can show you examples of, you get a hospital bill and they charge you $97 for a bottle of Advil, where they charge you just ridiculous, obscene prices that bear no basis to market reality. You're signing a contract with them. You can modify the contract. You don't have to agree to just take marketplace economics and throw them out the window and pretend like there's no sort of reasonable prices out there. You're letting them know that, listen, I want to receive treatment. I'm willing to pay. I'm going to have my insurance pay, and I'll come up with a reasonable amount out of pocket if that's reasonable and appropriate. I'll pay you up to 2 times the Medicare rate. Medicare kind of has rates set. Most physicians, most hospitals participate with Medicare. They accept the Medicare rate. It's kind of an industry standard. They may or may not like that, but they accept it. So you're letting them know, look, I'll pay you up to 2 times what Medicare would pay for you. That's reasonable. That's a market-based price, and you're allowing for a markup on the Medicare rate. But don't feel like you just have to sign whatever they give you. You can use this disclaimer. Also, as a side note, before you pay any hospital bill or any large medical bill, ask for a copy of the bill itself. Get a detailed line-by-line analysis, particularly of a hospital bill. They're very big. They have a lot of services. You want to make sure that you're not getting billed for things that your insurance company is still processing, or that your insurance company has an obligation to give them information. You also want to make sure that you can get a look at those line-by-line items and see what it is exactly that you're paying for. Another area that people can really help themselves would be in prescription drugs here. There's a couple of sites that I recommend. Many of you have heard different discount programs. I really like a program called Clever. If you're interested and you'd like more information on that, please reach out. There's also a website that you can go to get a good idea of what prescription drugs can cost. Drugstoreunlimited.com. There's a number of different programs out there. Also, ask your doctor's office, hey, this prescription's really, really expensive. Sometimes the drug companies will have manufacturers' rebates. Sometimes your doctors have relationships with them. They can give your doctor a certain amount of either samples to give you, or give your doctor's office information to enroll in certain discount programs that maybe they don't offer to the general public. So ask your doctor for help. Ask if they know of any prescription drug savings. Check out Drugstore Unlimited. Check out services like Clever. Now, these next couple of slides, I want to just give you some more examples of what you're potentially up against and what has gone wrong with the industry over the years. This story here, this is a story. Cigna was filed with a class action lawsuit that involved the case of a woman who went to get lab work done. I'm going to summarize here what this article reported. This is from a benefit broker service for health insurance brokers called Benefits Pro. And Benefits Pro recorded that this laboratory billed $17,000. I'm using rounding, approximate numbers. They billed this woman $17,000. They ran it through her Cigna insurance, and Cigna gave a roughly $14,500 discount. Remember when we talked earlier about, our people don't pay retail? This is an advantage of that. So the lab which was abbreviated as Health Diagnostic Labs, this separate company, said, well, okay, uh, that left a patient responsibility. The Cigna, by the way, paid $471. And when you look at the discount that they commanded, when you looked at what the plan covered, the patient's responsibility was $2,315.98. $2,315.98. Here's the problem. The patient allegedly, in the lawsuit, alleged that she called up and said, hey, if I put this on my credit card, what would you charge me? And the answer was $449. $449. So if she had just put that on her Visa card, that's what she would have paid. Because she ran it through Cigna, she had to pay over $2,300. And the pharmacy confirmed that when the Cigna plan covered 471, that covered the cost of the test. That obviously is greater than $449. Here's the real kicker. I'm sorry, I said pharmacy. I meant to say diagnostic facility. The laboratory here that did the billing, that is billing this woman $2,300, is owned by Cigna. It's alleged to be owned by Cigna in the lawsuit. So Cigna is giving you discounts, making you pay more than you pay if you put it on the credit card, and then one of their subsidiaries is pocketing the difference. So I don't know how that lawsuit has turned out, but that kind of gives you an idea of some of the things that people have been stuck with. I also here have an example when I was talking about some prices that you can go to. This may be a little difficult to see, but I looked in my area here in Northwest Florida, some of the how much a knee surgery costs if you just go get your knee done. The national average is $39,000. The average in my area, $19,000. But you can see just in my area in Northwest Florida, there's a difference between $23,000 and $14,000. That's obviously a lot of money. Now, if you live in a higher cost area like Atlanta or LA or New York or Chicago, these prices could be even different. But it just goes to show you that just because one person charges something, that doesn't mean it's the market price. I know we're not used to this, but you really have to get comfortable asking, I'm going to take a look around and see what other providers are available. And by all means, if you have a surgeon that you think is just the absolute best and you trust them, obviously your health is the most important thing. But there are plenty of very, very good, very talented surgeons out there that can do a fine job fixing your knee or anything else. And we've kind of divorced them from market processes. Let's not do that. Let's take a look and see, is this worth $9,000 to you? I'd like to also give you some price tools here that you can use. Healthcarebluebook.com, mdsave.com, fmma.org, fairhealthconsumers.org, and clinicpricecheck.com. These are all websites that you can go to and check out various prices and to help you shop, give you some idea of what's out there, what's available, and what assistance you can get. Final example I'm going to give you of another, just I think, what you're up against. This is United Healthcare. This is a recent arbitration dispute that they settled. And I'm summarizing the facts of the story. Again, this was in Benefit Partners Pro or Benefit Pro magazine. United Healthcare had a contract with some providers. I believe they were in South Florida. And the provider alleged that United Healthcare just stopped paying them the contracted rate. They just said, well, we know we pay you X, but we're going to pay you less than that. And they unilaterally changed the contract, which they weren't allowed to do. And it amounted to $91 million. It took this provider 5 years in arbitration, but they won the case. They got their $91 million back. The spokespeople for United Healthcare were not available for comment, but they released a statement that essentially said, we are unyielding in our fight to protect our consumers against unscrupulous providers that overcharge for healthcare expenses and make us all pay more for healthcare and for health insurance. So just to let that sink in for a minute, they lost the arbitration. The arbitrator agreed with them that, hey, you had a contract, you broke the contract, you underpaid these people. They then turned around and instead of saying, hey, we made a mistake, well, we still think this is too high, but a deal's a deal. They immediately blamed the people that they broke the contract with. So this is kind of what you're up against. If they're willing to fight that hard, they're willing to fight for 5 years in order to protect $91 million. They're not going to be afraid of you. They're not going to have any problem with letting you know that you're going to have to pay whatever they think you should pay. And it's not in your best interest to think that they have your best interest. Along with that, consumer protection, a few different things that you can do that I recommend. Again, get what's called EOBs, which is explanation of benefits, and read what you're being billed, including the itemized bills. Make sure that you're not paying for something that your insurance company should pay for. Bear in mind, if you go to a nonprofit hospital and you get a big bill and you just can't pay it, there are financial assistance programs out there. They're required by federal law if you're a nonprofit hospital to have a program in place. Ask them, tell me about your financial assistance program. I need help. They're required to give you that information and to consider an application from it. Another good place to look at is medicare.gov/procedure price lookup. And $4.org is a good organization to help fight big hospital bills. I know this is a lot of information, but I hope you can see now that you are potentially at risk when you use our healthcare system for some rather significant bills, but you don't have to be helpless. You could be an informed, empowered consumer. If you'd like some more information, I encourage you, please check out my other videos, my other content at Benefit Partners Direct on YouTube, Facebook, LinkedIn, and Instagram, or you can reach out to me on my website. You can contact me at mike@mikehodgesconsulting.com. And I'd love to hear from you. Please let me know what you think. Check out our other content, and I hope this has helped. Thank you very much. Have a fantastic day. Talk soon.